So, hi everyone, welcome to InnoHealth 2024. I am Anjali, host for the InnoHealth magazine podcast, and here I am with Major General Dr. Jagtar Singh. Welcome, sir. And he is also a awardee of Vishisht Seva Medal. So, sir, I want to ask, how are you?
I'm fine. Great.
So, how was your session?
Yeah, the session was great. It was a great learning.
Yeah.
Right? So I think if you're asking me about the inaugural session in which I spoke about Surgeon Reorienting, who's our senior from Armed Forces, that was an experience preparing for it and speaking about him. Right? It's always an emotional moment for us because he was like my guru and my mentor. Even in the forces and even after that. But the session that I attended after that, which is on the LLMs, that was very, very interesting and very enlightening.
Yeah. So, sir, as you are a very experienced person, so what are some approaches healthcare has sustainably evolved? What are your points? How sustainability in healthcare has evolved?
See, we have come a long way, right, in as far as sustainability is concerned. But there are still a lot to do in this, manner.
Yeah.
So sustainability, it depends on how you look at it. If you look at sustainability in a situation in a metro or let's say in a tier 1 city, it has different connotations from the sustainability that we see in resource constrained kind of environment that we have in the forces.
Yeah.
So it has both its challenges. I feel we have done fair amount of bit in the civil kind of a setup also and in the armed forces. But yes, there are areas which we need to work on.
Yeah, I agree, sir. So, sir, what are some of the practical steps we can take so that we can have innovations or sustainability in healthcare, or some of the armed forces steps we can take, we civilians can take? So.
See, in innovations, I always look at it in a manner that there are certain innovations which are the hospital facing or administration facing or the clinical facing, right? And there are certain innovations which are patient facing, right? What we are trying to do right now is basically more on the clinical facing, innovations. We are trying to maybe improve those processes. We are trying to put in more kind of an effort towards attaining more speed, more accuracy, more availability of these things. Yeah. But there are a lot of innovations that we need to do the way we deliver healthcare on the patient-facing side. What are the patient's actual problems? Waiting, getting an appointment, right? Getting his, medications explained to him, follow-ups, and then discharge. These are patient-facing issues. Are we really looking at them or wanting to do something about it? That's the question.
Yeah, okay. I agree. So yes. So, sir, what are some international healthcare innovations that we can adapt in India? See,
I was very lucky to be part of a study mission to US, right? And this was arranged by the CII, right? And there you got to see these hospitals which had been awarded for healthcare excellence.
Yeah.
Right. What I found a sort of a thread running in all the way these hospitals had sort of streamlined their healthcare delivery. They concentrated on one thing, and that was processes. That is important, right? We sometimes get swayed by too much of paying attention to structure. Right? As the Donabedian model of quality says, structure, process, outcomes. These are the three aspects on which the medical quality he defined, right? We keep concentrating too much on structure and then on outcomes, where we keep looking at these KPIs and things like that. They are fine. You need to have these. But I personally feel the actual challenge is in hospital operations, where you need to set and streamline processes. And that is where I found that most of the hospitals, scored.
Yeah.
Like, for example, I'll tell you about, we went to this hospital, MD Anderson, which is the cancer, hospital in Texas. Now, when you ask me about best practices, like anything and everything that a woman can face as far as cancer is concerned was all there on one floor.
Okay.
Right? So they had handled it so beautifully. The specialists were there, all kind of allied specialties were also there, the investigations were also there. It was just there for one. They had absolutely streamlined the flow of it. So this is something, we need to introspect, look at these things of how we actually try to deliver healthcare.
Yeah.
What we try to do is, a lot of times for our own convenience, right? As let's say doctors or as even administrators, right? How does it make things simpler for me? Are we looking at it from the side of the patient?
Yeah.
How does it, affect him, or how does it make things easy for him? How does it make things acceptable to him?
Right.
So that's an angle I think we need to, look at in all these things what we are doing.
Yeah.
Right.
Yeah.
And this is what I always have felt.
Yeah.
And I feel we need to reorient ourselves.
I agree, sir. I agree. So thank you so much, sir, for your wise words, and I love talking to you, and I'm very honored to share this space with you. So thank you so much.
Same here. It was wonderful, and I'm so happy that you were able to think of these things to ask me, and I'm glad that I could share some views.
It's my
Thank you. God bless you.
Thank you so much, sir.